My name is Ann Kennedy. I'm the Group Director for Horizon Health, and I have the pleasure of interviewing Tom Smith, who's the SVP of Clinical Excellence Practice, and I wanted to ask you a few questions, Tom.
Thanks, Ann.
So what does measurement-based care really mean for hospitals?
In our perspective, measurement-based care is really around data-driven care that utilizes practices around evidence-based practice. It helps support regulatory readiness in our facilities. It also assists us with making sure that we have positive patient outcomes with the units that we work with. It also provides a data-driven process that allows us to be a little bit more objective in what we do versus adding subjectivity to the care that we provide in our facilities.
Excellent. So talk to me a little bit about reducing boarding time from a clinical perspective.
I think some of the challenges that we face in our facilities is boarding in our EDs. Not only is it an issue with safety, which is probably the number one issue we deal with, but also from a staffing perspective, from a financial perspective, the best place for our patients to be is going to be on our units in our facilities. I think that early intervention and rapid stabilization within our facilities allows us to better care for the population that we're trying to care for. It also assists in reducing the amount of time that patients are waiting and that families have to deal with patients waiting in the EDs to ensure proper patient outcomes for us.
Excellent. How do we build a culture of safety in behavioral health? How does that work?
It's a challenging question. I think from some perspectives, how we look at a facility, how we look at what we need in the facility to provide a safe environment for our patients. But it's not just about the environment. It's about ensuring that our staff are trained properly, that they receive the proper orientation, that they receive the proper ongoing education to ensure that we provide a safe environment for our patients from the time they enter the units to the time they depart and discharge home. It allows us to make sure that not only is it a safe environment for our patients, but it's also a safe environment for our staff. Today, with the rise in incidents with our staff, we have to be conscientious of the fact that our staff are trained properly to de-escalate patients who have aggressive behaviors or who may require much more stabilization. And then that will assist us in the long run of providing that strong safety culture across our facilities.
Well, thank you, Tom. It's been an absolute pleasure to get your insight, and I look forward to speaking with you more on this.
Thank you, Ann.